Welcome back to Overhead Athletics. I'm Max Wardell. I'm here with Charles, also known as Chuck. What we're going to do is we're going to go through some throwing today. He's actually had arthroscopic surgery on the left hip, labral tear. This is actually a picture here that he sent me of MRI. So you can kind of see cam deformity on this hip. You can see how he's got a little bit of pincer deformity that's kind of broken a little bit of a fracture there, right where that labrum is. So you can kind of see that labral deformation, pincer kind of deformation there. And that's a lot of anatomical speak, pathology, musculoskeletal pathology. But in the end, we had a hip that didn't function right. It didn't have proper internal rotation away from the target, proper external rotation at the end, or for that matter, proper hip extension, which gave him a lot of low back stuff. We've dealt with stuff with him in the past, and a lot of it in terms of mechanics, we're able to eradicate and alleviate a lot of the pain that he was experiencing. So what I'm going to have him do here today is we're going to go right into just a lift of the ball. Another lefty. We got a lot of lefties here. And so we're just going to watch this throw really quick and we'll talk about it. So not bad. He's coming back from surgery. What do we see? Well, we see he doesn't like to cover distance. And this is hard for me, lefty, but he doesn't like to cover distance towards the target. And also, we see a little bit of a low elbow. So let's go in that position again. So what we're going to do from here is we're going to have him lift the ball from right there and go. Good. So this is his return to throw progression, already a little bit different in terms of the throw. Now we're going to jump to a position that we use all the time with athletes. We call it the IR apex, the internal rotation apex. And we'll talk just briefly about some of the changes we make. So if you see a guy with inverted W, this may be something you try. So a guy who's too much in this direction, which Charles has a tendency to get too much here and then end up a little bit low. And everyone has their tendencies. That's just his. For example, mine when I was an athlete was I would be a little bit too long. So everyone has their little things that they work on through the course of their career. With Charles here, it's getting his elbow at the proper height in relation to the plane of the shoulders. So what we're going to do here, position him even with the plane of the shoulder. And then if he likes to get here, we take him out of a little bit of pronation. If he were to be low, we would put him into a little more pronation. So we just took him out. Here's our standard. There's too much pronation. There's where he is. He's going to look at the target, load away into this new hip, essentially, and go. Good. So I want you a little bit higher. I want your trajectory a little bit better. And then what we see automatically is because he's got the ball in orientation that works for his body, that his elbow ends up in the right position as he goes through. The key thing when you're rehabbing a hip, in this case, or even a knee, is that we have to make sure that his body is in a position that will facilitate a proper arm action while we work on the hip. So that's really the key here for Charles, who is going into his second senior season of baseball due to coronavirus here. So he's in this position. We have him loaded away from the target. So we're working on actually loading into that hip there. And then go. Good. So what I'm going to have him do on this next throw is you got to cover 2-3 more inches with your stride. So this is a rehab process. We use a lot more verbal instruction in the rehab process because we need things to be a little more controlled. So go a little closer with your feet, but step farther, stride farther. Pre-position the arm. While we work on the lower body, for now, we pre-position the arm. Go. Good. So you notice, if you go back and double tap the screen, go back 10 seconds on the video or 20 seconds, you'll see that he lands and goes through this in a short stride. And he goes up and over a foot where the heel is elevated. If you watch this throw, because he covered more distance, he lands with his foot in a slightly better position. So try that again. We're going to do one more from there. And then we'll kind of go through another little progression where we're going to simultaneously work on the arm and the hip. So you kind of saw where he started in terms of his arm. You can go back and look at that video in the beginning. Go. There's that heel again. So what does he need to do? He needs to go back to 2 more inches. Now what we can do practically, and this is a great way to give him an external target, especially in the beginning, when we can't overload this hip. We don't have the ability to do that. We're going to put a mat on the floor here. Now he's got to step over top of this mat. So go in that position. So this gives it a little bit of depth so he can see that mat go. Okay, so he got over it. It forced him to go farther than he's used to. He probably didn't like it. Probably didn't feel quite normal. Now, what I need from you is I need you to go over that mat, but keep your arm without your elbow doing this. Bring your feet a little closer together. So once again, he's got to keep the arm stable as he goes over this. And that was an excellent throw. That's what you expect from a guy who's a fifth-year senior essentially now and is a guy that's, you know, a stud baseball player. That's what it should look like. One more time like that, and then I'm going to show you guys actually what we're going to do where we load into the hip and actually implicate the arm action as well. Keep this arm stable, get over that thing. Go. Pretty darn good, pretty darn good. So here's what he's going to do. Get in that position again. This time you start narrow, rotate, and reach. What we do with the reach, and I'll show you here with Charles in this position. Okay, what we're going to do here is he's going to reach with his body. Reach, 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 reach. Not so much with the arm. Okay, look at the target. There, so now he's reached with the body. One from there, and then I'll show you guys sideways. Okay, go. Good, now I want, you got to hit shoulder height or head height in the net. We always work into a net. Here's from behind. So you guys can kind of see the position of his body. Load it into the hip. Now rotate away. There it is right there. That's hip internal rotation. Just so you guys can see really quick, is his knee out? Certainly the knee is out and pointed this way, but he's in hip internal rotation from this angle because, hold right there, because he would be in hip external rotation if he just did this, but he rotated his pelvis, which makes the hip internal rotation. That's a misinformation that's out there online all the time. So he's rotated his hip, and then he goes. Good. Darn good throw. Now, why is this important? Hip internal rotation elastically loads the glutes in the throw or preloads the glutes in this position. The external rotators, posterior glute med, these things are external rotators, and by internally rotating the hip, I've loaded them. I've pre-stretched them a little bit. One more time from there, which allows me to utilize them at the end of the throw to elastically shorten and make the ball go fast. Arm action looks a little better. We're going to work on that. We're going to come back to you guys hopefully in a couple weeks here with Charles and another video, and we'll show updated how he's a little bit more efficient with the arm, how we actually dynamically load into the hip. Right now we're doing static stuff where he's starting in that position. We want to show stuff where he's loading into it as he goes. He loads into the hip as he goes towards the target. So he can actually have a successful, very successful season, get the looks that he wants to get, and hit the MPH on the radar gun that he wants to hit. If you like this video, hit thumbs up. Make sure to subscribe to the channel so you don't miss the next video with Big Chuck here, and we'll see you guys in the next video. Thanks.